Welcome to Lightbulb Moments, presented by LAVIDGE, a Phoenix-based marketing and communications firm. Today, Stephen Heitz and Tim Troll will share a few highlights from a recent research study.
Welcome, I'm Stephen Heitz, Chief Innovation Officer at LAVIDGE, and with me is Tim Trool, our Chief Strategy Officer, and Susan Beyer from Audience Audit, who does attitudinal segmentation research and has been one of our partners for many years. We've been working in healthcare for a long time and been doing research, our own research and research for clients for a while, Tim. Why don't you let us kind of fill us in on what our research scope has been over the last decade and how this particular new study we've done fits into that?
Yeah, so we've, as you say, healthcare is one of our kind of primary industries that we focus on. And so we've done not only proprietary research for healthcare over the last few years, but also worked with a lot of clients. Before COVID, we did some research immediately after COVID to see how things had changed in consumer attitudes and what people were looking at. Certainly a lot of changes then, and then now, as we start looking at, how have consumers kind of move forward since the immediately post-COVID. There's a new thing coming up now, which is technology, and how really healthcare companies are embracing more technology, using technology for not only efficiencies, but also to help them to, provide better diagnosis and outcomes. So, we want to just kind of keep our finger on the pulse of what's going on with healthcare, not only for our clients, which we do research for them ongoing, but also just in general on where the category is going.
Let's talk about attitudinal segmentation and why it's so unique and why we use it as a basis for our marketing and research activities.
Yeah, it's a quantitative research, which is, I think, really important when we're trying to your point, keep our finger on what's happening, to know that we've tasted enough of the soup to know what's in the whole pot. But the attitudinal segmentation, in terms of our work, the reason that that's really what we are devoted to is because it gives us an organic view of what's going on in the mindsets of people who are experiencing a category. We see studies all the time where if you look at differences in age or income or gender, that's fine. You could see what people under 20 think or whatever. But when you start to lay an attitudinal component on top of that, you really understand that a lot of the time it's not about those things. It's about a direct experience that people have had regardless of age or whatever. So getting that mindset level on the data, I think, is really helpful in understanding who we're dealing with, especially from a marketing standpoint, but just generally, what are people thinking?
Well, and it's like the missing piece from the other research. The other research is really important, and certainly that is something that we need to look at. But this is kind of that missing piece that we really never had, that kind of gets into people's minds on what they're thinking.
Yeah, I think it's an important lens when we're looking at data.
So statistician Andrew Ehrenberg famously said that your customers are really other people's customers who occasionally buy you. And I think what he was trying to say there was that when you look demographically at McDonald's or Burger King or this hospital system or that hospital system, you're going to see the same demographics. You're going to see the same age breakouts. You're going to see the same income levels. You're going to see these gender.
Sure.
And so when you look at those, there's duplication.
Yep.
And the law of duplication basically says that its customers are trading brands. I mean, I don't only buy one type of beer or these kinds of things.
Right.
So attitudinal segmentation basically says, why are our customers because demographically they look the same.
Right.
When we compare our share.
Understanding why people are making the choices they are to be loyal, to not be loyal,
right,
are critically important for all kinds of decisions. Marketing, obviously, but lots of things.
Correct. I think of the Taylor Swift phenomenon that we've just been through here recently. And
we know you're a Swiftie.
Sorry, hey, now. But Swifties come in all genders, ages, income levels, right? And I think that where we are with branding today is branding is now about, Dr. Collins talked about it as people like me do things like this.
Yes.
And so that's where the attitudinal segmentation comes in. And I think when marketers try to simplify to demographics, they miss out on unlocking the power that can really change the share of their brand. So that's why when we talk about attitudes today, that's a big differentiator, because if otherwise you're ignoring a lot of these things, and you probably have a conversion rate ceiling, you've got all these kinds of other challenges, and you're just fighting it out.
Yeah, I mean, what happens is you assign your own assumptions about how people are thinking based on a demographic. So you irritate people and misinterpret them, and you miss out on opportunities
in tribes
that you think may not exist because of a certain demographic profile that actually are really good for your brand.
Well, and I know we compare it off a lot of times to politics or religion.
Yeah.
You know, I mean, if you're a follower of a particular party, that crosses all demographics.
does.
Same thing with religion.
That's
it's
right.
the same kind of a deal.
Since we've done this, we've identified in the past 4 types of ways or attitudinal segments around healthcare consumers. And I don't think that our new study on how their experience changes the original 4. So we had an original 4 set of how people interacted mainly with their provider, whether they were a team player, going to do whatever their doctor told them, whether they had self-diagnosed on the way in and they were the boss, you know, whether they were a bystander who wanted nothing to do with it until their leg was falling off, or whether they were really a cheerleader for those kinds of things. Now this builds on this and kind of creates an additional window into how they feel about their experience with the system together, not just their provider and the outcomes, but with the system and with technology and all of that. So this is really more of an experience lens. So what do we find, and how do we conduct the study? Give us a little bit of methodology, Susan, and then maybe we can go into what we found in the new attitudinal segments.
Yeah, you bet. So as I said, quantitative study, this is a big survey. Respondents were anonymous. We have a huge cross section of the U.S. population, basically. We've got pretty much everybody represented in here, and it's a statistically reliable study, so you have a high level of confidence in the results.
I think the only thing was that they had to have engaged with healthcare over the past year.
That's right,
That's
which
really the only
almost
criteria.
everybody has.
Yeah.
Right, exactly. And then in addition to the questions around their demographics and questions about sort of what experiences they have had and what they've done, we put 40 or 50 sort of attitudinal statements in front of them that they can rate from I agree completely to I disagree completely. Everybody who takes the survey rates all of them. And then we do an analysis that doesn't superimpose our assumptions on how they're going to break up. We don't predetermine the buckets. We don't say, we think there are people like that and we're going to put you in that bucket. Basically, their responses tell us what the buckets should be. And what they are is groups of people who have a mindset about things. They connect a set of attitudes together in terms of whether they realize it or not, right? And it really colors their perspective and their decisions around these topics: healthcare in general, healthcare providers and organizations, technology use in healthcare. So it's kind of a deep dive into sort of one arm of what's happening in healthcare right now that can sit on top of the basic research that we've already got.
Okay, specifically, these are more related to their experience with technology and with healthcare.
Yes.
And how technology and healthcare overlap.
That's right.
So Tim, what did we find? What were the segments?
Yeah, so you were talking earlier about how there's so many commonalities between the past studies, whether it be the studies that we've done proprietary or studies for clients. We did a big study for labs. We've done a big study for health insurance.
Correct.
So I think that we're finding a lot of common themes on how people are really experiencing their healthcare environment. Specifically, as you put the overlay of technology on that, I think that really does kind of go into, maybe reinforcing what some of those other ones were. So there's 4 different groups that kind of came out of this study. Pretty much an equal distribution of each one of the groups as far as, percentage-wise.
Just because it shook out that way.
Yeah, there's one group which is we call frustrated. We see them in every study that we do.
Yep.
They're frustrated with the system. They're frustrated with dealing with doctors. They're frustrated with dealing with health insurance companies. They're just frustrated in general.
Yep.
And because of that frustration, they're also even more frustrated now whenever you layer technology onto that. So they're not real thrilled about jumping into technology. They're frustrated with everything. They're going to stay frustrated. There's another group, and you had talked earlier a little bit about a group that in a previous study that is much more willing to take their doctor's advice. Well, there's another group which is called appreciative. They're almost like the early adopters of technology. they're like, you know what, this is great.
This is great.
This is something good. I love working with my provider. I love working with the healthcare. I have no problems at all with these people. This is great.
We're lucky to have this health
Yeah,
care.
and I really want to use this new technology. So that's that appreciative group. One of the other interesting things about appreciative, even though demographics don't really fall into this, the appreciative group does tend to skew a little bit more male,
Yep.
a little bit more higher income,
Yep.
and they tend to be a little bit more what am I going to say? Happy with what they're doing in
So
general.
you're basically saying they're privileged.
Yeah,
A little, yeah.
and also a little more conservative too, which is
Yeah.
interestingly enough. Yeah,
It's working for them.
It's
The system's
working
working
for
for
them.
them
Yeah,
now,
we
so
found
the
that out.
Because they have
technology.
access.
Because they
Yeah.
have access.
Frankly,
yes.
they have access.
And they trust the system.
Yeah.
So the technology overlay for them is like, I trust you, bring it.
There's another group that we call skeptical. One of their biggest issues is they're very skeptical that any new technology or dealing with any large healthcare system is going to be a challenge for finding out their identity and about their healthcare practices. They are scared to death
It's a privacy concern.
that the privacy part is going to be, now that we have technology, different things that are applied to that, now that they're going to be open to anyone or anything out
Just
there.
makes it more vulnerable
Yeah,
from a privacy
so
standpoint.
from adopting the technology, they're like, I don't necessarily know that I want to do that because I don't want to leave myself exposed.
Yeah, they really wonder whether any of this is actually for them
Yeah.
or if it's just to make things easier on the companies.
Yep. Well, and that's a big challenge, is that they oftentimes, and across all these groups,
Yeah.
really see the healthcare system as looking out for themselves rather than
Their patients.
their patients.
Okay, so we've got frustrated, appreciative, skeptical. What's the last one?
The last one is equitable. Again, a group that we tend to find in most of all of our studies. They have kind of a altruistic view of what healthcare should be, and that everyone should really have access to healthcare. They should be able to pay a lower cost for healthcare, and there shouldn't be any kind of challenges with healthcare. When it applies to technology, they look at this and go, you know what, technology, great, as long as you're passing the savings along so that more people can get the help that they need.
Yep.
But they also are a bit like the skeptical group in the fact that they're saying, well, I don't know that the healthcare system is going to do that. So, but they really do want everyone to have access to healthcare and to get the kind of healthcare that they need.
Yeah.
All right, so a couple of things with the frustrated group. What are their communication needs? What are their key concerns? I know you talked a little bit about just frustration in general, but can you give me a couple of attitudinal statements that bind them together and how those might fit?
You know, they're frustrated at a lot of levels, let's be clear. So frustration that they don't think that in their direct engagement with their providers, they have enough time with them, that they're being heard when they say something. You know, I think one of the comments was from the frustrated, when we had open-ended responses, was, you know, it's just really, it's no fun to be sitting in a doctor's office and they're looking at a screen all the time instead of me. You know what I mean? So they have a frustration that they're just, their provider is not engaging with them in the way that they would like.
They're a number and they're not a
That's
human,
right.
you know.
And then that elevates their frustration when they're looking at their health insurance, you know, requirements, the paperwork, the cost, the billing. It just
complexity of
all
it all.
piles on top of
Or even
that.
simply being able to get in to see
See
them.
somebody.
Yeah.
You know, scheduling an appointment months in advance and
Yeah.
not being able to see them. They're just frustrated with the system.
The other thing is I'm worried I won't be able to get care when I'm sick.
Yeah.
Because of access, because of whatever plan that they may have, because they can't afford the care that they need. So it's sort of it's bad now, and I'm really worried it could be bad if I get in real trouble.
Yeah. So you can imagine how to try to communicate with these people when they're already,
Yeah.
you know, kind of in a place of, you know, being fed up with it.
Do you feel like the next group, the appreciative group, has a role in helping the other groups understand, or are they kind of like, well, you guys are kind of in a bubble, we're not really going to trust anything you tell us
They could be
about the
ambassadors.
system?
I mean, that's
Yeah.
a good point. I mean, the appreciative group, they're bought in.
Okay.
They're bought in, and they trust what's going on. They have good relationships with their providers. They have good relationships. They feel that the system is doing what it needs to be doing, and you know, they certainly could be ambassadors. You know, maybe from a testimonial standpoint or something like that. But I don't know how much credibility that they lend to some of the other consumers. Maybe they do, maybe they don't.
Yeah. I mean, I think a lot of us make decisions because of what the people around us say about their experiences and recommend or say, ooh, don't go there. So I think if you're lucky enough to have people who are appreciative and are having a good experience, then there is a potential impact when you have the opportunity to choose healthcare coverage or providers or visit a particular facility or pursue a course of action in terms of your healthcare. I think we can't forget about the one-on-one, but I agree with you that there might be some skepticism from people for whom that is not their experience. To have people, especially if
they seem privileged in some way.
If they seem a little more privileged, to say, your experience is not what's happening to me.
Okay. So there's two groups that are kind of on this other side of this equation, and that is the frustrated group, which is just, I think, more overwhelmed than anything else. And then there's the skeptical group you guys talked about, who is kind of like, kind of got that privacy concern lens there. How do we address the skeptical group? What are their key areas? And if you're trying to win over this group, or if you want to make this group your tribe as a brand and really be, how can you address them?
I think the skeptical need information. I think part of what they're worried about is the black box about what is happening to my data, what is new technology, what are the implications on my data. I almost felt sort of why aren't you talking about this? Like this whole thing, this AI thing, this is coming, there's a lot of adoption. Why aren't you talking about how it's going to impact me and where my data goes and who's using it? We've seen a lot in the news about what's happening with AI and stuff like news and content and art and all those kinds of things. And I think they are cautious with respect to trusting that companies are going to do the right thing.
Well, another thing I thought was really interesting, one of the defining attitudes says, advancements in healthcare technology won't do much to impact my health.
Yeah.
Right.
Yep.
So I think this is also coming down to the reality that, okay, maybe it helps the system, maybe it does some admin stuff in the background, but am I going to be a healthier person because of this advancement? And I don't know that we've made that connection yet down to that individual level of...
Sure, and I think that they're looking at technology and going, I'm not sure that this is going to have a positive impact on that one-to-one moment, a patient interacting with their healthcare provider. Tell me how it's going to help that. That's really where the rubber hits the road in terms of healthcare. And I think they're like, is this being done to support that relationship, or is it being done for some other reason that's maybe not my priority?
Right.
The skeptical group to me is kind of interesting because they cross industries. I mean, if you think about even the advertising industry, there's this. There's agencies that are skeptical about technology, AI, and what it's going to do and how it's going to impact you.
Sure.
Yeah. Well,
so look at all kinds of different industries.
Well, you could even look at the in-person remote work debates, right?
It's just,
technology gets in the way of healthcare providers really connecting with their patients.
Yeah.
It's one of their key attitudes, right?
Yeah.
So.
Yeah. I mean, the elephant in the room is the erosion of trust across everything in our society over the last 5 to 10 years. Well, and it's these folks.
And in the healthcare space, I mean, it's, 3 out of 4?
Yeah.
People don't trust the healthcare system. They think it's broken.
Yeah.
Today. So, I mean, that's, that there is just coming back from trust.
Yep. So they've got skepticism about a variety of things that are affecting this technology and healthcare conversation we're having.
What are some of the defining attitudes for this group, the equitable group?
So in general, they want to make sure that everyone in the U.S. has access to healthcare. They really want to know that, everyone can be able to get the kind of healthcare coverage that they need and the healthcare support that they need.
Sure.
They also want to make sure that, healthcare is really something that's cost effective for people.
Yeah.
So that they can really afford how they can, get their health taken care of.
Yeah. They have very specific beliefs about what makes good healthcare. Providers listening to their patients, treating them as a whole person, not just a liver.
Yes. Yeah. The whole person thing comes up quite a bit. They were the first ones to say, I need to feel truly cared about, body, mind, spirit together.
That it should be personalized to each patient. And so I think they have this vision of a strong belief of how healthcare should work, and also a recognition that is not the case for a lot of
Sure.
people. And so that gap concerns them.
Yeah, they also wanted freedom over their choices, despite what their providers might be telling them.
Yep.
And like I said earlier, this is the altruistic group.
Yeah.
Yeah.
You know, they really want it to be the wonderful society where everyone is taken care of.
Yeah.
And let's talk about some other light bulb moments we kind of found in the study. And I think one of those is around the use of technology. And there's some excitement there.
Yeah.
Where's the excitement around the use of technology specifically?
So when we talk about technology, and also we're going to talk about AI, I think, in a minute.
Yep.
So there was a lot of interest in how technology could improve things, specifically when it came to making things easier, making things faster, making things more affordable. So a lot of interest in if this will allow me to get in more quickly, if this will allow me to get my test results more quickly, if this will reduce the cost or the time it takes to get results back.
Okay.
Little more equanimity about things like, this is going to do my heart surgery.
People are really open to the admin part of technology.
Yeah.
Like telemedicine and things
Sure.
like that. I mean, they're really
Yeah,
open
and
to those kinds
telemedicine
of
had a
things.
big bump in our recent
Huge bump,
study.
yeah.
Yes. Yeah.
So they're open to those kinds of things, but I think that there, at least at the beginning of the study, there was a bit more skepticism around some of the more advanced things that technology can provide.
Yeah.
Yeah, one of the things I saw was that where it came to advanced early detection,
Yes.
like around MRIs.
Yep.
I think about the new whole body scan.
Using technology to
to
find
find
treatments
things.
and cures
Yep.
for things.
And that literally 63% of everybody was kind of like that. That goes back to that test results and identify effective treatments
Right.
early was a huge win.
Yeah, and this is not a category we're going to participate in and then leave behind us. That we're in this for the long haul. And I
Sure.
saw a lot of optimism about the fact that technology could continue over time to make healthcare better, stronger for patients. So there was a lot of excitement. I mean, that's the word we used in the survey. Like,
Yeah.
which of these things
Things are you
excite you?
excited about?
And we see high percentages, over a majority, and a lot of them, of people that are really excited about some of the things that technology is bringing to the table in terms of
Yeah,
healthcare.
I think when it gets below the 50% excitement mark, you're starting to get into those like, nanobots and things
Yeah, the
like
real
that.
Right.
The stuff that's a little
Right.
further
Well,
out
people
there.
just don't understand fully
yet.
yet.
Yeah.
Yes.
So that was the other insight around AI. We asked them in the beginning of the study, how willing are you to have, having AI part of your healthcare experience?
Yeah.
And then we measured it again at the end of the study. What did we find?
Yeah, we found that there was a pretty nice jump. There's about an 8% jump.
Yeah.
From the time that we first introduced, or we asked them about it first, introduced some of the concepts, and then asked them about it later. So that just shows us that education is such a big component here. If you help people to understand
Yeah.
Correct.
what the technology is, what it can do for you, and how it can
Right.
support your healthcare, then there's more acceptance of it going forward, which I think from a healthcare marketing standpoint, it's very important to know that, instead of just jumping into, here's the new technology that we have, you need to educate your patients.
Yeah, and quite honestly, the survey was not built to educate them.
No.
It was really questions. But there were questions like, to what extent are you excited about any of these things? Talking about opportunities, specifically with new technologies and AI. And I think we see this sometimes when we do these surveys and ask this sort of paired question, that even just seeing potential
Correct.
in the survey can make people feel
Yeah, because
better.
it was like a 1 or 2 line description of each one of these.
Just very
different
short and sweet.
technologies.
Yep.
But that was enough
Enough
to get
to
them
make a
moved,
major
yeah.
statistical shift
Yeah,
in
so
their
I think
mindset.
so I
Yes.
think if you're in a position to really do education
from
and
marketing, and that's what marketing, communications, advertising is all about.
make people
Yeah.
feel heard and their questions are answered and sort of
Yes.
build that relationship, there's a lot of opportunity. If we can bump it that much just by asking some questions, imagine what you could do by answering
with a
them.
great campaign. Exactly, intentional campaign.
Yep.
It was interesting to find out that patients are really into cost reduction, and
Yes.
they're doing their own cost reduction work. What are they doing?
Yeah, this is really interesting because we have not always seen this. I mean, I think some of us who are a little older can remember when there was no option. You just sort of got what you got and that was it, But what we see now, and maybe it's influenced by the economy and some of the things people are struggling with, but there is a majority of respondents specifically doing things to try to reduce their healthcare. The number one was living a healthier lifestyle. People
Yeah.
are trying to stay out of the healthcare system as
So
much
that's
as possible.
fantastic, right?
Yep.
And it has a lot of implications for our wellness category.
Yep.
Sidebar,
It
but
all works together.
Switching to generics when they're available, using discount apps for prescriptions that help, checking with providers about, are you in network? You know, if you go through open enrollment, you know the difference between going in and out of network, and that has become a realization that consumers have, so they're checking with that. Unfortunately, there's also some negative things that people are doing to reduce their healthcare costs. We saw it last time we did this too. Delaying care, skipping care completely, picking and choosing treatments that you think you can afford. So there's some really positive stuff that I think people are doing, but there's also some negative implications. But there is no argument that consumers are not interested in reducing the costs that they bear due to healthcare.
there's a real disconnect between the experience and satisfaction. That's a lot to unbundle, because you would think that I would be dissatisfied because I had a bad experience, or if I had a good experience, I'd be satisfied. But since that's not the case, where is one of those key disconnects?
You know, one of the things we need to remember is that patients, healthcare consumers, are experiencing healthcare at a variety of different levels. They've got a one-to-one situation with a particular provider in the room. They've got an experience with the front desk and trying to get an appointment. They've got an experience with the paperwork associated with paying for that appointment. So their satisfaction for most people is way better at the, I'm in with my provider and I'm getting good care. They care about me. They can't spend enough time with me, and I wish we had more, but generally. And then as you go up the food chain, it gets markedly, gets markedly worse.
I see.
Yeah. On the edges of the system is where they really have the disconnect. A lot of the times, you know, dealing with the health insurance company on trying to get the bills paid. You know, dealing with the system, as you said, to be able to try to, you know, get scheduled on time. And this isn't new.
Right.
Again, this is something that we've continued to see.
Which is not to say that there are not issues with the provider interaction.
Yes.
So the majority of respondents in the survey do believe that providers like doctors and nurses on the sort of generic level truly care about helping patients. That's not something that there's a lot of disagreement about. But even in that one-to-one experience, there's a widespread feeling that they don't get enough time with providers. They're not given enough time, that there's maybe a lack of empathy, that there's a lack of being really heard and having sort of an engagement, as opposed to somebody saying, well, that's just in your head, or you don't need that, or whatever. So I think there's still opportunities both for providers to make improvements themselves individually, and for organizations to support them in providing some of those things that really affect satisfaction with patients.
Well, and one of the things that they do is that oftentimes the patients will give the provider a bit of a pass and say it's because of the system that they don't have time to do.
They have to see 30 patients a day, or whatever.
So they kind of give them a bit of a pass, but they also are not scared about jumping ship.
Right.
And saying, I want to change.
Right.
I want to change providers, or I simply won't listen to what they do and just won't even do that, which is worse.
Right. And so when you think about those segments, again, if we look at that overlay, there are some people who feel very comfortable pushing back on a provider and saying, I need more time. You need to explain this to me better. I have a question about this. And others who are just like, I'm out, you know, and just find the situation so uncomfortable and frustrating that they kind of exit.
Yeah, so I think what I heard you say is this is impacting outcomes, because treatment outcomes are directly correlated to some of this in the communication and either the not following through or their ability to do something specific. Okay, so I think the other thing that we kind of are seeing through all of this is personalization, right? So what does this really mean, this theme of personalization? What does it mean, and how does that impact these different areas of the patient experience?
I think that personalization, a lot of it is about that one-to-one experience. Like, don't look at your screen, I'm here. I'm different than the last guy that was in this room sitting on this crinkly paper, right? Like, pay attention to me and my issues. And I think that for a lot of the level outside the room, it's just feeling like a number. Anything you can do to try to help someone not feel like a number.
Yeah, I think personalization goes all the way from the time that you're about to call to make the appointment.
Right.
and them not being able to find your record, not knowing who you are, give me your phone number, your social security, all this
Yeah,
stuff
yeah.
before I
Right.
can even find you, all the way through the time that you're meeting with the physician,
Yeah.
and afterwards, whenever you're trying to deal with the insurance company on getting that paid.
Right.
So that personalization really does go through the whole experience.
Yep.
Not only just when you're there sitting
Yeah.
on the crinkly paper.
And even if we get beyond the operational and
Yeah.
think about how brands are communicating, again, aligned with this trust problem, feeling like you understand me and you can relate and you have empathy with me drives a lot of trust and feeling seen in people. And so I think even brands have a role to play in communicating that, look, we understand your situation. We understand, you're not a number to us. And we're running our organization that way is a powerful message to people. We trust folks that we think get us, and want to help us. And I think a lot of people feel like all of the stuff that happens between a brand and a patient can not feel very empathetic or personalized or caring, unfortunately.
Let's kind of wrap this with really what does this mean for our marketing teams doing advertising, communications, customer marketing?
There are a lot of benefits from attitudinal segmentation, and from what we're finding in this study is, I think, probably the most obvious benefit is it really does put the patient first and helps us to find the kind of messaging that we need to develop that really resonates most specifically with each one of these groups. Because as we talked about, each one of these groups thinks differently, they operate differently, they have a different experience. So being able to really hone in the messaging to what it is they're looking for is very important. The other thing that we can do is we can really, because of what we know about their attitudes and what they do, we can really kind of reach that right patient with the right message at the right time. So that's really important because you are kind of meeting them where they're at and where they really need to be.
And you've got all of them. Like it's just the way it is. You're going to have to speak to them differently, but you're not going to be able to pick and choose and say, I only want these.
Yeah. But if you want to pick and choose a little bit, you can actually optimize your budget.
You can. That's
by
true.
saying, you know what, here's an opportunity for us.
Yeah.
And maybe, within the appreciative group, this is someone that we want to, continue to talk to them and use them as our ambassadors or whatever.
Sure.
And so we could certainly get some more, kind of movement out of them. It really does improve efficiencies, because if you think about it, if you're doing mass media or if you're doing mass emails or you're doing those kinds of things, what happens is now we can actually go in and say, okay, well, we really want to be much more specific on who we talk to, when we talk to them, and how we talk to them. So it really does help from budget efficiency standpoint as well. It informs different opportunities, not only from a marketing standpoint, and we've talked an awful lot about operations here too. And I know that it sounds like that there's not a lot of things that are operationally issues that we could kind of solve whenever we're rolling out a new piece of technology. How do we then start talking to our customers about those things, which really goes into marketing. So it really does kind of inform what we do all the way from the very beginning within the organization throughout the very end of it. It helps us with innovation too. I mean, and again, much of this study is very much about innovation and how we handle innovation.
Yeah, and I think that there's even opportunities for innovation in each of these categories. Like telling the frustrated people that we have a new solution for you. There may even be a business model there that removes frustration, adds revenue to the healthcare organization, but by doing that, targets a group of people and really propels some new thinking forward. I think of simple things like what One Medical is doing with that subscription fee of $150 a year, but that gets you immediate access the same day. And those kinds of things are just simple ways and are ideas of new business models that can disrupt the business. I think of Mark Cuban and Cost Plus Drugs.
Yes.
Coming back with transparency, getting the skeptical people out of that. Is also tackling the equitable conversation in a head-on way. There's disruption that can happen by truly understanding these segments and scaling into them.
And it's so powerful to feel understood and seen. So you do need to tell these groups that you understand that the differences between them and that the experience may not be the same for everybody, but you're working to help everyone. And I think that can be powerful for folks.
All right. So I think at the end of the day, we would love to take you through the deeper full research study and work with you to uncover those areas of innovation and opportunities, and even just maximizing your budget and efficiencies so that you can get better effects throughout your organization, but also in your marketing and advertising budgets to do more with less.
To hear about how this research can provide valuable insights to you, download the research study or contact us to schedule an appointment to learn more.